Brock contacted me 2+ years ago. Was ready to have a hair transplant. At the time he was just 18 years old and was already experiencing some pretty significant hair loss. We decided at the time that it would be in his best interest to hold off on doing transplant and go through a more conservative route. Now, at the time, he wasn't too fond of that idea.
No.
Like most young men, he wanted to get his hair taken care of as quickly as he could because he was frightened and nervous and scared. I had to explain to him the benefits of being patient and getting on finasteride, which we did. We put him on finasteride for a better part of a year. His hair improved significantly enough where I felt comfortable then that we could proceed safely with a procedure. The reason he's important to me as a patient is because he represents, I think, a large swath of young men out there that, in my opinion, sometimes will make a decision prematurely before really getting good guidance. He had a completely successful procedure. He was able to listen to me and understand and trust me to use the medication first, which he did. And then we brought him in over a year ago to do his surgical procedure, which, as you can see, has turned out to be a complete success. It isn't always the easiest thing to hear when you're a young man that, hey, we have to wait a year before we even consider working on you.
For all you viewers out there my age suffering from hair loss, I think the first thing is just get on the preventative treatments as soon as you can. Don't fall into like the scams that's just saying like, oh, this supplement's going to give you great hair growth, or this one thing. It's kind of like a concoction of many things. So get on your big three. So your minoxidil, your finasteride, your laser. Live a good have a good healthy diet. Take your biotin supplement. A concoction of all of those things, I think, will give a better result than just trying to focus in on one of them and put all your hopes on one preventative treatment. Another thing too, I think in my opinion was important looking back, was to measure your progress in years and not in months. I feel like whenever I looked at my progress in a year span instead of a month span, I was a lot more pleased. I feel like when I was looking at it, my progress in short periods, I was kind of driving myself crazy.
When you look at him, everybody worries about there being this big scar from doing a linear procedure. Well, listen, I'm going through as slowly as I can, and it's very difficult to appreciate any scar just even as short as his hair is. Now, I can see where the scar is, and if you really want me to point it out to you, I will, but it really is very difficult to see, and it's very fine, and it's right there. But he keeps this cut down to a 1 or a 2 guard, and it's really not visible. Make sure that you're approaching this from the standpoint of what is it that's going to be best for me in this particular process, and that you have someone that's helping you with that, whether it be a surgeon or a consultant, somebody that's really looking at you as an individual, which is what I tried to do with Brock. And that's why I'm so proud of how well he's done, because it was not easy to tell an 18-year-old young man, hey, listen, you're going to have to wait a year. That's not what he wanted to hear. But in the end, it was the right thing to do. And if you follow the right process and you know what you're doing, I promise you, you're going to end up with better results.